move to our oral comments in person. I'd like to state that we do not respond specifically to comments during the public comment period, but we do take it into account when we deliberate.
Hi, good afternoon. I'm Mehalik. I'm the director of the Breathe Project. Thank you for this opportunity to provide public comment. The Allegheny County Health Department needs to have its air program fully funded. The cost of the program should be carried by the significant polluters seeking pollution permits. Additional costs should be covered by the county's budget. Equipping ACHD with the tools that it needs to protect our 1.3 million residents is a no-brainer.
The air program we currently have is ours on loan from the federal government. It is not ours to keep if we cannot maintain through staffing and financial means in order to ensure that we're keeping in line with the federal rules. So I do urge this board to move it forward to public hearing.
To ACHD's credit, Deputy Director of Environmental Health, Jeffery, did his due diligence. He presented a lengthy report about the state of the air quality program's finances, complete with a detailed proposal to shore them up. Unfortunately, the committee lacked a quorum that night and was unable to vote on the plan. It was the third straight meeting where no formal action could be taken for the reason of lack of a quorum.
And then finally, we need to think of this funding as the first step towards achieving this mission. We can't do what we need to do without doing this. It's also important to take other steps to increase retention and fill the high vacancy rate, including increasing salaries and taking other steps to address retention issues. But at a bare minimum, this is critically important for the county to be able to fulfill its legal obligations. So I encourage you all to vote yes today to take the next step towards public comment. Thank you so much.
Earlier this year, a group of residents from the Mon Valley released a report from 2020 to 2022 findings entitled Fine Particulate Matter and Mortality in Allegheny County, Pennsylvania. Soot pollution from this report is shown that it kills between 640 and 1,373 people each year in Allegheny County. Low-income communities had 33% higher proportions of these deaths than higher-income communities. Communities of color had 18% higher rates of these deaths than other communities. This means that 3.5 to 7 times more people are dying each year from air pollution in our county than from COVID-19.
Current air quality in Allegheny County is damaging the health of residents. All of us rely on your air quality program to change this reality. We all deserve clean air, and we all deserve a quality of life that allows us to open our windows and spend time outside without worrying about how air pollution is damaging our health or that of our children and neighbors.
From the ACHD permits alone in the last 2 years, eye, nose, and throat irritation, nausea, vomiting, breathing, cough, COPD, asthma, respiratory ailments, fertility issues, dementia, Alzheimer's, kidney disease, stroke, damage to the central nervous system, cancer, new research showing direct relationships between pollution and mental health. Good job, everyone. I see why this county is always scored and rated as an environmental failure.
Here's what we know for sure. Allegheny County needs a fully funded air quality program. Full stop. We think that's something that every breathing being in the county can agree on. The proposal is not perfect, and we have concerns, absolutely. But this is all the more reason to approve it for public comment. ACHD has said that it needs all the brain power it can harness to come up with an appropriate way to fund its air quality program. Air quality remains one of our most pressing public health issues. So please bring the proposal to a vote and send it.
An industry spokesman criticized ACHD for not conducting economic analyses before proposing fee increases because of the impact the fees would have on businesses. The health department must begin with the impact the pollution has on county residents. The current permit fees are an insult. $8,000 a year to put more than 100 tons of pollutants in our air. $8,000 doesn't cover the cost of emergency department treatment for one asthma attack.
ACHD should instead be increasing its investment into these positions, including ensuring that these staff members have the proper technical expertise to enforce the Federal Clean Air Act and protect the community. ACHD's proposal to raise permit fees is well justified based on the full accounting of the work that goes into enforcing these permits. They are not arbitrary raises and would close most of the operating budget shortfall while ensuring that ACHD is run in a more sustainable and fiscally responsible manner.
Good afternoon. My name is Mark Jeffery. I'm one of the active and fully engaged Air Advisory Committee members since 2012. I'm an Allegheny County resident. I'm also the plant manager of the U.S. Steel Clairton plant. Today, the department is going to recommend to the Board of Health 2 changes. The first is a modification, Article 210907, penalty, fines, and interest. And the second is an unreasonable increase in permit fees, up to 700% for some sources, because the actual fee amounts are not included in Article 21, but only referenced. It appears that the proposed fee changes will be presented to the board, both the Board of Health and the County Council, for approval and documentation separate from the proposed Article 21 changes.
I had the joy of being at the meeting last week for the Air Pollution Control Advisory Committee. And I say joy because Mr. Rabinowitz, I thought, presented it about as clearly as he could. And then he went through minus them between 15 minutes or a half hour of question. And one of the questioners was Pauline Davis. Pauline Davis works for U.S. Steel. Questions are one thing, but then she voted. A person that has a monetary interest per job should not be voting on public policy. If I'm missing something, I'd like someone to tell me. How can an employee of U.S. Steel vote whether or not his agency is fully funded? He's the one policing her. Doesn't make any sense, but she voted and she was one of the 3 that voted against. So I would hope that she would review that. She should have recused herself, or the chairperson should have not allowed her to vote.
The response from our public health allies at ACHD was silence. This has been the case for other high-quality science reports, such as an NYU study that showed significant decreases in emergency room visits, as well as pollution levels immediately following the closure of the Shenango programs. Here we're hearing a lot of noise today about a request for a meager $1.9 million out of our county's budget of about $1 billion. Actuarial valuation of human life in the U.S. ranges between $1 million and $10 million. FEMA uses $7.5 million in its valuation. Even at the lowest end of the scale, Allegheny County experiences damages between $640 million and $1.4 billion because of lost lives each year from soot pollution. The cost of the budget shortfall is the cost of saving 2 lives.
The numerous activists for many years which have been approaching this board with our concerns have never been allowed to even have a healthy dialogue. We've been searching for answers to how we can work together for the benefit of all, not to fight with you, to enable you to value our diligently researched data, to ensure a healthier life for those subjected to unbearable life-compromising health conditions. Sure, there's a workable path for industry to thrive and the people as well. We're not your enemy. Our work in the trenches with people would aid you in resolving health issues for those suffering. Clairton, Coriopolis, East End, wherever the need may be. Reach out and touch. Somebody is coming. Make this world a better place if you can. Thank you for your time.
Thank you. Anything else? Okay, so then I can please repeat your, Mr. Chairman, I'd like to make a motion. Okay. Second. Any further discussion?
Is there a chance that we could see all those minutes that I know we asked for when you presented back? How long ago was that? I mean, it's important that when we have an advisory board, we'd like to know what they're thinking. I know food safety did one hell of a good job of documenting, and I'm not saying you didn't, don't get me wrong, but all that information was privy to all of us.
It's been approved up to date up until June. We can certainly get
July.
Right, July has not been done. June has not been approved, so I just want to double check to make sure that. So yeah, forward on.
All in favor? Aye. Opposed? Abstentions? Did you want to say why you're opposed?
I just on the reaction of the advisory committee not approving it. It's a tie, right?
It was a tie, yes.
That's why.
It was a tie with no recommendation either way.
Remember Robert's rules on a tie? I thought
Robert's rules on the tie say that the chair who shouldn't be voting in the first place can waive the tie.
That wasn't done, it sounds like.
No, that was not conducted that way. That was the third time they did this. That I can remember.
But thanks for clarifying. Thanks for clarifying your vote. So the motion passes.
And could I make one more comment? I, as a human being, intend to do a right to know request for the draft minutes of the advisory committee's meetings, which have never been approved for lack of the majority vote. And we will see whether there is any legal basis whatsoever for these minutes having been withheld. There are minutes from last year that are still not approved and are not visible to anyone. So this is the third time that I have brought up this matter, which is of great concern to me.
So noted, thank you.